Karen Pratt. Dr. Brunton is an assistant professor in the School of Physical Therapy at Western University and is a registered physiotherapist. Laura's current research focus is exploring and understanding fatigue and pain experienced by individuals with cerebral palsy and the possible relationships with physical activity, sleep, pain, and mental health. Laura has an interest in developing novel approaches to increase and support the self-management skills of youth with cerebral palsy. A secondary interest of Laura's involves the development and validation of clinical measures to support comprehensive assessment of clients in clinical practice. And Karen Pratt is in her first year of a PhD in kinesiology at the University of Toronto in the Adapt Lab. Karen recently completed her Master's of Science in Health and Rehabilitation Sciences at Western University. Her research explored the effects of participation in therapeutic horseback riding for children with cerebral palsy from the perspective of the children themselves. Karen is a therapeutic riding instructor and mentor. She has been involved in the activity for over 10 years. Karen is a registered kinesiologist and works in a pediatric rehabilitation setting in London, Ontario. Karen is a lifelong lover of horses and the outdoors. She can usually be found in the barn with her horse Pippa and her new puppy Lily. Karen, Laura, can I turn it over to you?
Absolutely. Thanks so much for the introduction. Okay, I'm going to share my slides here. Awesome. So I'm going to jump right into our presentation here. So Letitia already gave us a great intro, but I wanted to add also about myself because we have lots of potentially Cantra instructors in the room right now, that I'm also a Cantra certified instructor as well as with PATH and a PATH mentor. And I was recently the head instructor at Therapeutic Riding. So lots of different perspectives. I have kind of perspectives of lots of different coaching perspectives, as well as kinesiology and research perspectives. And Laura's here and she might jump in at any point. Okay, so what is therapeutic horseback riding? So therapeutic horseback riding is a recreational adapted physical activity that is taught by a riding instructor. So this is a very important point that differentiates therapeutic horseback riding, so THR, from other activities such as equine assisted learning or hippotherapy. So the main difference I want to kind of highlight here is between hippotherapy. So hippotherapy is different because it is a therapy session that is on the horse. So a therapist, like a physiotherapist or an occupational therapist or an SLP, will kind of run a therapy session using the movement of the horse as kind of the treatment tool. So this is very different from kind of what our study's on, whereas we're looking at a riding instructor that teaches the activity of riding to individuals with a disability. So THR is designed to enhance cognitive, social, emotional, and physical well-being of individuals with disabilities. So this is just like a standard definition. But it's quite interesting, as I was kind of doing more of a deep dive into the literature on THR, there actually isn't a whole lot of research that supports that definition. So we'll kind of dive deeper into that later, but the physical benefits of THR are very well documented. So like balance, strength, gross motor function, coordination, and muscle tone. So this is across different conditions. So what about the impacts on psychosocial and overall well-being, including mental health? So with this, there's anecdotal evidence only. So meaning that parents or therapists or coaches, say that, yes, we are seeing psychological or social benefits on the participants, but there isn't actually any research that has been able to show that. So that's kind of what we were hoping to explore more in our research. So what is cerebral palsy? So cerebral palsy, or CP, refers to a group of disorders in the development of motor control and posture occurring in a result of a non-progressive impairment of the developing central nervous system. So important here is that it's not progressive, and the motor disorders of CP can be accompanied by disturbances of sensation, cognition, communication, perception, and or seizure disorder. So the primary disability associated with CP is motor impairment. So this means that individuals with CP are at risk for decreased habitual physical activity, decreased cardiovascular fitness, and have an increased risk of sedentary time. So the population that we wanted to look at for our study was children with CP, and this is because it is the most common physical disability in children. And this stat here I got from the Can Child website. So 1 out of every 400 individuals in Canada are diagnosed with CP. Okay. Okay, so what we want to do is we want to find opportunities to increase physical activity participation for children with CP and decrease sedentary time. So what about therapeutic horseback riding? So this would provide a very unique opportunity for physical activity participation, where we see we know there's physical benefits. It could be an enjoyable and fun way for children to participate in a physical activity and potentially provide additional impacts on the psychological side as well as the social side. So we're going to talk about children with CP. We selected an age group of ages 5 to 12. So Cantra says the youngest you can participate in THR is 4. So we just wanted to go a little bit older than that. So we selected 5. And then 12 was kind of our oldest age because we didn't want to get into teenagers or any effects of puberty. So just this, so strictly staying within the child age. So they do have this risk of lower physical activity, also a risk for social exclusion and mental health conditions. So finding ways to kind of promote positive participatory experiences is very important for this group. And participation in physical activity can positively impact health-related quality of life. And also some studies are starting to show that it can also impact happiness. So THR could impact multiple domains of health. So it could impact psychological, social, and physical. However, no studies have actually looked at all of these domains together. And if they looked at multiple domains of health, the results were kind of inconclusive or inconsistent. So participation in leisure activities is essential for the development of skills, socializing with peers, exploring personal preferences, and just enjoying life. And participation in physical activity is critically important for maximizing well-being in children and youth with CP. So we see across the literature inconclusive and inconsistent findings, despite positive anecdotal feedback from parents, coaches, and therapists. So there was actually an RCT, so within research, that's kind of like a randomized controlled trial, that's kind of our gold standard. And there was this really interesting study in 2009 in Australia. And, you know, the authors, everyone was really hopeful that it would show these positive results on different constructs such as quality of life. It actually had very disappointing findings because they showed nothing significant for the people who participated in it, even though we know that even though everybody in the study, you know, said that the riding did have an impact on their lives and it was very positive, but it just didn't show it in the study. So there's kind of been some commentaries that wonder, like, maybe we're not measuring the right things. There might be benefits that we haven't thought about. So Dr. Peter Rose and Bob wrote a commentary on this, and he actually suggested kind of considering findings within the ICF model. So I'll show the ICF a little bit later on, so you can kind of get if you see it, it makes more sense, but it's a holistic view of health, basically, where participation is one of the goals in life. So this model could maybe provide perspectives on the elements of participation that are important in THR. And it was important to use a combination of methods such as qualitative interviewing with children and adults, as well as quantitative outcome measures to kind of provide these additional insights into what it is about THR that seems to make a difference in the lives of children with CP. So that is kind of what we ended up doing, but also something that was really important to me in the research was including the children's voices. So as a coach, throughout my years in the teaching in the arena, I've witnessed so many, magical moments or wonderful things, or the kids have told me these, like I've been looking forward to riding all week, like I'm just so excited to be here. And, you can really witness these moments, but this hasn't actually been shown in the research. So I was kind of confused as to why this wasn't being shown. And then I was like, why don't we just ask the children themselves and figure it out, or find out why they like this activity so much, and why we are, like, as coaches, seeing them achieve different goals. But the research actually isn't showing this. So as it turns out, this is kind of novel to go to the children themselves within the research. And it's starting to become more of a trend that we are seeing children being integrated into qualitative research studies. So children and youth with disabilities, are immersed in the world of rehab and health from a very young age, and they have lots of different experiences to draw from. And getting them involved in research is kind of critical to understanding the impact of rehabilitation services on the lives of people with disabilities. So, and it really brings their voices, varied voices, to the research, and kind of, again, it's starting to become more common in the literature, but it's still definitely pretty new. What else? Okay. So I'm going to jump into our method. So this is what we actually did. So this study is situated within the constructivist paradigm. So I'm just going to, this can be kind of confusing, but mainly what it means is that everybody has their own unique reality. So like my experience of therapeutic horseback riding would be different from somebody else's. And even though there might be common elements between them, that we're never going to have the same experience because we have a unique reality. So that's just kind of the lens that I used throughout this whole study. And so we selected an embedded mixed methods design, which meant that we had qualitative data and quantitative data, but we focused on the qualitative data collection and used a phenomenological inquiry to collect, analyze, and interpret the qualitative data. So phenomenology is kind of the study of so it's just like a way to get to the essence of an experience. So like an everyday life experience, phenomenology tries to figure out what it is about that experience that makes it meaningful. So, and then I've kind of touched on my unique position to do this research because I've been so involved with THR for so long, but I also had experienced the healing powers of horses. I live with chronic pain. So the horses, actually one of the horses we talked about later on, Wyatt, was really critical in my kind of management of my symptoms. So I was very interested to research therapeutic horseback riding further. So the objectives of our research were objective one was to explore how participation in THR impacts mental well-being, social inclusion, and perceived levels of independence in daily life activities for children with CP. And then objective two was to determine if participation in THR results in changes in fatigue, pain, and overall well-being scores for children with CP. So this just kind of shows how we had the two different aspects of the qualitative side as well as the quantitative, and some of the different measures that we had looked at. The qualitative interview took place at the end of the riding period. And then we had originally planned to have journals throughout so there'd be like qualitative data throughout the study, but I'll talk about that later, but we didn't end up getting as much as we had hoped from the journals, but that was the goal. And then the quantitative side, there was an online survey sent out before the riders started their riding session, and then they filled out the same questionnaires at the end. So the kind of idea there was that we would try and see if there was a change in the scores on these different measures. Okay, however, as we all know, we're in the midst of this kind of ongoing pandemic related to COVID. And unfortunately, the time we were going to start my study was March 2020, which was exactly when everything got shut down. So well, we had to kind of take a pause and wait for things to reopen. We had originally had 4 riding centers that had agreed to participate. And unfortunately, 2 of them did not reopen in September 2020. So we just were able to recruit participants from Surrey Therapeutic Riding, just outside of London, and then Wetra, which is in Windsor. So due to having less centers, and also the centers were running very reduced program size. So we normally within qualitative research, you do purposive sampling. So kind of having a sample that represents everything that you want to see within your sample. However, this was not possible. So we had like a convenient sample, which ended up working out just fine. And we had an online Zoom interview instead of an in-person interview to reduce that social contact, which also added some added challenges. As you can imagine, interviewing like a 5-year-old over Zoom wasn't the easiest, but it ended up, again, working out just fine. Just some added kind of considerations that you don't really realize until you're in the moment. And then the analysis shifted to fully qualitative due to the smaller sample size than expected. So we just did not have enough participants to be able to power the quantitative analysis. So in my thesis, I did present the data that we were able to collect, but it just was not enough to do any sort of analysis with. So, so this analysis is for the qualitative side. So we looked at, I wanted the phenomenology to be relevant to healthcare practitioners as well as families. So we used Van Manen's phenomenology of practice. So kind of what I mentioned before, finding that essence of the experience. So to construct a possible interpretation of the nature of a certain human experience. So basically, everything was transcribed from the audio tapes verbatim, and I used an inductive and iterative coding process. And it means kind of that went through it many, many times and didn't have like a set idea of what it would say, tried to see what themes emerged from the data themselves. Also use lots of reflexivity within this, so acknowledging my own role within the research study. And so from the kind of the smaller codes, we were able to go into larger themes that emerged across the participants. And there really was a lot of common themes across the 4 participants. So I was able to kind of group them into these larger themes, and then I was able to integrate them into the ICF model. So using the F words of childhood disability as a guide. So the F words are a way to make this more, family friendly, able to be shared with people who maybe aren't in the research community. So I'll show what F words are as well as how they link to the ICF framework. So the ICF framework, as I mentioned before, is this holistic model of health where everything within the model is dynamic and interconnected. So if there's a change in one area, it's going to have an impact on everything else, which I think is a really amazing way to think of health, because, just all of the factors that can impact one thing. So within the ICF, we have body structures and function. So this is kind of the focus of a traditional biomedical model of health, whereas within the ICF, participation is more of the focus. However, we still take into account, body structures and function and everything else here. So the F word that kind of corresponds with body structures and function is fitness. Activities is anything about like what you can do in an ideal environment. So like if you were in a physiotherapy gym, what can you do there? But that might look different than what you can do in your community, which would fall more under participation. So activity is linked to function, friends is linked to participation. Then we have family. So family is the kind of essential environmental context for children, and their family has the biggest environmental impact on a child, which makes sense. That's who they're with all the time. So we had some interesting kind of results relating to family within this study. And then personal factors, or, all those individual things that make a person who they are. And within the F words, this is kind of linked to fun. So what I find fun might be different than what somebody else finds fun. So trying to find ways to, or finding activities or things in the community that are fun for each individual child. And then kind of the overarching goal of child development is future. So looking ahead to the future, how are we going to impact all these things so that the child is able to carry them forward in their life. Okay, so that's like a super brief overview, but hopefully it helps. So diving into the results here. So we had 4 participants in this study. These are just kind of some of their characteristics. Even without the purposive sampling, we got a very representative sample. We had 2 females, 2 males. We had an age of 5 to 8. So we got kind of that younger side as well as a little bit older perspective. We also had quite an even range across GMFCS level, which is just a way to describe distribution of involvement within CP. So like quadriplegia here would be like a level 4, and we see all 4 limbs that would be involved or affected. And then CFCS is just like the communication levels. So pretty much all the children were able to communicate directly with me. Okay, so these are the themes that emerged. So the most important theme is in the center here, which is that connection and bond to the horse. So this was actually seen as the overarching theme that impacted everything else, which was very interesting and exciting to see. And then the size of the arrow kind of corresponds to the importance of the other themes. So we see all the other F words here. Where the next one after the connection and bond to the horse we saw was fun, was the most impactful to the children, kind of followed by function. So within function, I'm going to highlight that this was more focused on sensation. So like how riding the horse felt as opposed to like, so like the riding, when I trotted on the horse and felt bumpy, it was jiggly. I felt the horse's fur and it was fuzzy, that sort of thing, as opposed to fitness, which is actually of much less importance here, like where we saw strength or balance or coordination difference. So function was definitely much more related to that sensory experience. Family was very important. And then I added in feelings here. Feelings don't really fit into the framework, the ICF framework, but they were extremely important throughout the interviews, and the children repeatedly would tell me like, I feel happy, I feel excited, I feel sad when I leave riding because I just miss my horse. So trying to find a way to put the feelings in there and these kind of complex feelings that the kids were having was really interesting to dive into a bit more. And then we saw friends, which were actually not that impactful. There was a lot of not very many opportunities for social interactions within the lessons. And then future was kind of small. It's kind of hard to ask, if someone really little about their future, but how we were able to explore this was asking if they wanted to continue to participate in therapeutic horseback riding. And all of them were like yelled, yes, like I absolutely want to. So that was how we kind of linked in future there. And I'm going to talk more about the connection to the horse shortly, because that's our main finding that I definitely want to expand more on. So here's some quotes from the participants. So my horse makes me feel happy. This was one of the riders saying to their dad here, like the first time she was riding on her own, look, I'm doing it. I'm really doing it. I want to keep horseback riding because I love it. It feels good, and then it feels good. So this capitals here, the participant was actually shouting this. So it feels good. I was excited. I was so excited to beat Misty, and I like her very, very, very much. And then this was one of the parents. I feel like she has her own unique activity to do that is all her own. Oops. Okay, and then this is a word cloud that they made with all of the, basically all of the the answers from the interviews and put them all into this word generator, and this is what came out. And it was really amazing to see this, because the bigger the word, the more it was said. So here, like, feel was huge, and like all these positive things, like if you go through it, like, my horse makes me feel happy, feel good. I love riding. I want to go riding horseback, like all of these very positive things. We see dad, we see mom, stuff about the horses. And again, this like really importance of feelings and riding. So all these very positive things that were highlighted that really linked back to the themes that we saw. Okay, and then here's our journal drawings. So only one journal was returned, unfortunately, but probably just due to COVID and mailing it in and everything. But so these drawings just kind of, again, reinforced how the riders were feeling. So this is one of the horses here. And today the riding made this rider feel happy. And this is the horse here, and he's going to eat some apples. So So it turned out that the rider was hungry, but he thought that maybe his horse was hungry too. So the horse was eating apples. So they were both hungry. So it's really neat how the horse was feeling the same thing that the child was feeling. And then within the lesson, so the turtle here is just, we did like a slow walk, which was like a turtle walk. And then we also did a fast walk, which was a cheetah walk. So that's just why it says there. I think said he was feeling like a turtle because he was hungry. Okay, so implications here. So this is Wyatt. He's one of our therapy horses, and a horse I've worked with him for many, many years, and he wants to share the implications here. This is the first therapeutic horseback riding research study that we know of to show that the social and emotional connection to the horse is the most important factor that influences participation outcomes in children with CP. So what does this mean, having the horse as a friend? So like anybody who I've shared this with in the horse community, that this was our main finding, is like, and same, like I own a horse. I worked with Wyatt for many, many years, like I always thought of the horse as my best friend, and anybody who owns a horse, feels the same way. So like if we feel that way as adults, why wouldn't a child feel the same way? Who's coming to a riding lesson, right? Like why wouldn't the horse be their friend? So that was really interesting to have that perspective. And like I feel like as a coach, you get so caught up in like making your rider achieve their riding goals, or you have to work on steering or 2-point or everything, but really it's more about fostering that bond with the horse, and what are the emotional and social implications of having a horse as a friend. Like that just remains to be explored, but I think it's a very positive thing having a horse as a friend, this big animal that doesn't talk back to you, but it's just there for you. It's pretty amazing. So the best part, also I was going to add there that the human animal bond is something that's just starting to be understood. We see there is some papers in other conditions like autism spectrum disorder, some psychiatric disorders, as well as trauma research that kind of show how this bond with the horse can have a very healing aspect. In ASD, so in autism, they're starting to show too that like the bond with the horse can translate into improved social interactions in other settings. So again, like this has not been shown in kids with CP before, so we really don't know what it means in other situations, but just really interesting to see where this research will go. So the best part about, so this is another quote here, I asked like, what's the best part about going riding? And the participant was like, well, the best part about THR is riding the horse. Like, yeah, okay, makes sense. Like it should be that. And, I think, again, there's so many other things that you get caught up with, really just making that experience the most fun and special that you can for the rider. You never know what activity is going to, leave this lasting impact on them. Like, I'll talk about later, but like one of them, gave the horse a carrot, and like that was the most exciting thing. And watching the horse eat it, and like they eat carrot, like we eat carrots too, and the horse liked eating the carrot. So just finding those links and making it fun, and packing the little bag with the carrot and everything, just something so small to us is really huge for these children. So I kind of touched on this before, but like the sensory experience for the child was what they wanted to tell me about. And that was what was so exciting for them was, when I got on the horse, it felt bumpy, or I could feel the horse's fur with my legs. And it, I really liked how that felt, or I liked petting the horse. But the parents would be like, well, don't you feel strong when you ride? Or don't you feel, tall? Do you feel like you sit up taller, or this or that? And the kid would be like, well, yeah, I guess. And then would continue on to tell me about, the first time they trotted or whatever. So I think, again, just looking at things from that child's perspective really gave us some different insights. And throughout all of their answers was this, really sense of excitement or happiness relating to anything related to THR. And, like all day or even all week, they're looking forward to going to this activity, and, it makes them so happy. And even talking about it, like around the dinner table, like, oh, what's my horse doing right now? And that sort of, it really, really translates into other aspects. What else? Oh yeah, one of the riders, for every question, answered, I feel happy. Like, okay, awesome. I get it. You feel happy, which was great to see. And this was just a picture from one of my lessons many years ago, definitely shared with permission here. So we also saw this very interesting family connection to the activity. So because of COVID, often, or the parents or other people within the family, like siblings, were asked to be part of the lessons by the centers to reduce this physical contact between like strangers, which would be the volunteers normally in the lesson. And I think as an instructor, I was kind of nervous to have the parents in the lesson. But it ended up, the findings of our study showed that this was actually a really amazing opportunity, because there isn't really other opportunities within the community for families to participate in a shared adapted physical activity together that was so positive. And that wasn't, like a therapy session or, going to the hospital. They were all together with the horse and focusing on something that their child could do. And it ended up like the parents shared that they had bonds with the horse. They were looking forward to meeting the horse every week. They were excited to be part of the lesson too. And like the kids loved having their parents with them. And then they could also share stuff with their siblings, like around the dinner table, and like the whole family just had this kind of snowball effect, which was really, really neat. Unfortunately, this is something that the social time with other riders in the lesson was mostly absent. Some of them were riding private lessons, but really like I think 3 out of the riders had other kids in the lesson, and there was no social interaction really at all. So definitely something to keep in mind. The riders shared that they felt independence on the horse kind of more through tasks that they were doing, such as, like no longer having a sidewalker, or, being able to go off lead or something. So these very tangible things where they were more on their own. And when they did, when I asked them, like, did you like being on your own? They really liked it, and they felt really good about it. But we weren't really seeing or able to kind of talk about if this independence on the horse was translated to other settings. So that would be interesting for the future. And then we talked about how they all wanted to continue participating. So just kind of to sum up these kind of highlights here, or of the implications, is that like promoting physical activity and healthy behaviors over the lifespan is a challenge for healthcare providers. So the unique blend of features in THR that promotes participation in physical activity. So it's really great that they seem to have an impact on the desire to participate long term. And The insights gained from this inquiry may help providers make more informed recommendations about why this activity makes a difference in the lives of children with CP. And another study had showed that children with CP preferred physical activities when it was fun with friends, with family, or animals, and THR has all of those aspects. So that was neat to see. So now we'll kind of go into some kind of recommendations. So for families, participation in a THR program can provide a social and emotional bond with the horse. It can provide your child with having a horse friend, which is pretty amazing. And again, we're still kind of exploring in research what this might mean, but it definitely, at least in our study, and showed that it was the most impactful part of riding, or of therapeutic horseback riding, that impacted participation for them. Learning riding skills that may boost confidence, gaining independence on the horse, having the sensory experience that just feels good, and has a positive impact on overall well-being. So seeing that impact of the psychological, social, and physical domains of health, kind of all encompassed there within overall well-being. So this is kind of the bigger chunk here. So practice for THR service providers and instructors. So I'm definitely happy to chat about this more later as well, kind of in the questions. But for instructors, we should really focus on, and for THR centers, should be a focus within the lessons of fostering this bond between the horse and the child as much as possible. So, horsemanship activities like grooming is so huge. And another paper I was looking at was like the physical touch that you have with the horse is something that's very unique. And, especially right now within COVID, that you're not there, that aspect of physical touch isn't really there, but with the horse, you can do that and it's safe. So grooming, and like the riders told me, like they loved grooming because they could pet the horse and the fur felt so good, and or not the fur technically, but the hair felt so good, and like they loved touching the horse, and like horses are so responsive to grooming, right? So it's this really bonding experience, grooming. So even if the rider can't go in the barn, like making it a part of your lesson is really important. Even talking about like, what did the horse do today? How did that impact, how is that different from my day? Like, what did you do today? Well, this is what your horse did today. Giving the horse a treat. Like, any of the riders who told me they gave their horse a treat, it was like the highlight ever, giving the horse some food. And I asked another one of the riders if he'd ever done that, and he said no, but like he would love to, right? And just learning more about the horse, like all the riders would talk about, like this one time my horse pooped, and the one time it sneezed, and this and that. So just kind of finding all those opportunities within the lesson, and again, like you never know what's going to stick, like yeah. And making the lessons fun. So, again, just, riding the horse. What is so much fun about riding the horse? Like, if you ride a horse, think about what you like, and try to incorporate that in. And probably the kids will like it too, like games, having competitions, having dance parties, having, at the end of the game, having an opportunity for the riders to talk to each other, ask them about their horses, all sorts of things there that are easy to add in, but have such an impact on the riders. So we really need to boost social interactions between riders. So providing these opportunities for them to talk or play with each other, especially because oftentimes kids with CP are excluded within the classroom or have less friends. The fact that there's another kid in the riding ring with them, like it's the perfect opportunity for them to have a new friend. So that is something that really needs to be focused on. And then finding ways to continue family involvement in THR related activities could be a novel area for centers to make even more of a difference in the lives of children with disabilities. So it doesn't need to be riding here. It could be like, having a family-centered grooming program where the whole family gets to come and groom a couple horses. Like that would probably be really amazing for the whole family. And then recommendations for healthcare providers. So we'll be able to inform families that participation in THR can impact multiple domains of health. So the psychological, social, and physical through the connection or bond to the horse, and then also through the fun feelings, fitness, function, family, friendships, and the future. So future directions for research. So this study really lays the groundwork for future studies. So further exploring the meaning of the bond between the child and the horse. What does it mean to have a horse as a friend? Does this translate into improved social skills in other situations? Continue to explore the positive impact of the shared activity of THR for the whole family. A long-term study of how THR impacts happiness and overall well-being, including pain and fatigue. So pain and fatigue were something that we really wanted to look at in this study, but just wasn't possible with our smaller sample size. But I think definitely in the future, this is something that should be looked into more. So just acknowledging here that there are limitations to the studies, such as generalizability of the findings. However, this was expected from kind of that paradigm, that overview that we had looked at, and it definitely lays the groundwork for future research in this area, as we saw these common elements across the children's distinct realities. The findings of this study extend current knowledge and hopefully will impact practice and generate ongoing research. So this indicates that the study provides a significant contribution to the field of study. So I was looking kind of around Alberta. There actually isn't any cancer centers in Alberta, which I thought was kind of odd, but there is lots of therapeutic riding centers, and I just listed a couple here, but I know the organizers also reached out to quite a few in the Calgary area. So we can definitely, there's lots of centers within Calgary and Edmonton, Lethbridge, all around there. And then finally, so in conclusion, this is me in white again. So in conclusion, this is the first study that we know of to show that the connection and bond to the horse is the aspect of participation in THR that has the greatest impact across multiple domains of health for children with CP. It provides recommendations for families, service providers, and healthcare providers. And finally, it sets the groundwork for future research in this area. Okay, we've got some references, and then our lab, the chair research lab here, and that is everything. So be happy to hear, oh, perfect, right on time. Be happy to hear some questions.
Thank you, Karen.
You're welcome.
We'll open up the floor to questions. You're free to pop your question in the chat, or you can turn your video on and raise your hand and unmute yourself. Karen, I'm wondering if I can start off. And my question to you would be, in your background information, you had mentioned that the current research at the time was not really seeing the differences you would expect, and highlighting the benefits of therapeutic horseback riding. And it's very interesting that you saw such a difference in the parent and child perspective. Do you think that that difference is the reason why the previous research was not showing the benefits?
I think it plays a large role. Like there was kind of looking, there was some studies like in hippotherapy that talked to the actual participants, and they were older, they were adults, and they really were able to articulate kind of that they were feeling a connection to the horse or different things. So I think definitely, it's much newer to have children's voices within the research. So definitely, I think that's a large reason. And also that they weren't really looking so much as these participation outcomes. They were looking more at other constructs like quality of life, which is really kind of hard to measure, especially within children. So I think, and also the ICF model wasn't really considered in really any of the studies so far. So kind of all those things together.
Thank you. Patty, do you have a question?
Just a comment, when you were looking at your research, did you look at any of the equine assisted research that has been going on in terms of pro-AFW, equine facilitated therapies? Did you look at any of those and how they focus on the attachment to the horse?
So I did come across some of that. It is more in other conditions though, not so much with CP. And also like it's much more specialized, the equine assisted learning, like having the mental health professionals, but it is definitely focused on that attachment to the horse. But it's not very, like where I'm located here in London, it's pretty new. There's not really too many programs around here. So I wanted to see more of, if we could see those same, or not the same things, but see it more in the therapeutic horseback riding setting, because it's more common. It's like we're getting some stuff in the chat here. I definitely, so someone here is saying, did it, okay, so a lot of post-participation surveys are given to parents. It's very interesting to consider asking the kids. Yeah, definitely. Yeah, totally different perspectives there, as we saw. Yeah, who knows, maybe that could be something for other post-participation surveys for centers, have an opportunity for the kids to write something too. Even if they just write like, I felt happy, like that's a really beneficial impact for them, right? And something that should be noted. Okay, did your study include any observations or evidence of therapeutic horseback riding improving connection or positive relationships with siblings? So we did see two of the riders actually shared about siblings. So one of them, one of their siblings actually was riding horses like in a different setting. So it created this really nice bonding opportunity for them, that they could both talk about horseback riding, that they each rode a horse. And so that was really unique and really, really special. And like the parent who shared that, thought it was so incredible that her kids were both doing the same activity just differently, and they could, now have this shared bond. So that was really cool. And then another one with the siblings, they wanted to go to summer camp together, but the camps weren't running. And like, she was so excited at the thought of going to summer camp with her sister. And like her sister would come and watch her ride. And, that was just so impactful for her to have her siblings. So definitely we saw some positive stuff with siblings. And okay, do you believe that more research in THR would contribute to more funding for families that would benefit from this type of therapy? Yeah, definitely. I know within the States, I've seen some studies that are being done and they're getting funding. So I think kind of the study was quite small, but if there was that kind of larger scale study and getting more funding for that, definitely could kind of raise awareness. And most THR centers are charities, so that would be really neat.
Can I interrupt? It leads into my question, and thank you so much for this research, because it's so valuable and important. And I was asking about, where are you capturing this information? Like, who are you sharing this with? Where are you capturing it? If we could make one database, because I've heard many studies that also support the benefits of therapeutic riding. And I too have worked in the States, and many of the insurance companies there will cover this as a benefit, similar to physiotherapy and other benefits that they offer on their plans. But the more research we have in Canada, the more likely that will happen. Insurance companies have to be convinced, if you will, that there is benefit to this. And the only way that they'll judge that is if we have data collected. So I'm just wondering if there is one database, so that if I'm on another call like this, that I can direct that person, like, oh, here's where we're capturing that information. Just go to this website and log in your findings. Do you know of anything like that?
So I mean, definitely from like a research perspective, there's lots of databases, where you can find the research studies. And like this study, I'm in the process of writing it up now. So like we will be publishing it to a research journal, and it would be, stored within that research journal. But I do plan to share it with like PATH and with Cantra. So like maybe, then there's a way to disseminate that within the centers. But definitely it would be really cool if somebody put together like all of the studies within the areas. that could be all in one spot. But I think it kind of, unfortunately, the onus is usually on the individual to do that kind of literature review or everything for yourself.
Yeah, it would be so powerful. And I'm a member of PATH as well. And we've had this conversation on many of the leadership calls. So hopefully we'll get a database together eventually. I'll let you know.
I remember hearing that with PATH as well.
Right.
Hopefully we'll get there. Okay. Several cancer centers in Alberta. Yeah, I don't know, maybe my internet just wasn't working with the map. So that's great. There is them. I stand corrected. Do you think it is hard to assess progress in the kids due to the stages of brain development, especially in the younger ages you had in this study? So I think definitely like that's something to consider. I mean, all the tools that we were using were validated for ages like 5 and up. But definitely, you know, like within the interviews, like framing the questions so that the younger kids can understand, or having, you know, we did have that communication scale that kind of assesses that. And who knows, like, you know, other studies might be able to look at, you know, kids who have a lower communication abilities, like having alternative text and that alternative communication devices. I think that would be really neat. Also another future type of research. But yeah, definitely something to consider within those younger populations. Okay, I don't see any other questions in the chat here. Anyone else have any questions, comments?
Hey, it's Laura here. Sorry, everyone. I'm just really supporting Karen on this call, but I just wanted to touch base about that last question around, you know, do we think that it's hard to demonstrate changes in these kids? And I know that from other therapeutic relationship type studies where we're looking at different types of therapies, it really is just generally difficult to document change in these kids. And I don't know whether it's, you know, the fact that we're looking for like these big mind-blowing changes in physical function that we don't see. Just knowing this population of kids with CP, they tend to kind of hit their gross motor function levels pretty early in life, and they kind of either maintain those or sometimes they even decline. But what I think is really powerful about Karen's study is that with the focus on physical activity and the focus on physical function and, you know, changing the physical elements really took a back seat here, kind of by accident, but wonderfully so. And I really think that her psychosocial benefits that she demonstrated here are really what we should be selling, and that those changes don't have to be large to be impactful. And so that's probably my favorite part about this whole study, is just showing how fun something can be that can also be a bit of a challenge to the physical side of things, and challenge them to just develop independence as well.
Absolutely. So someone else here, we're working to develop and boost family involvement. Are you developing any emerging strategies that you're willing to share? So actually my PhD research is focused on family centered, you know, interventions and physical activity opportunities more within the community. So stay tuned on that, because it's a really, yeah, there's not a whole lot of information there, but I definitely think like some sort of like horsemanship activity, because, you know, it would be very difficult to get a whole family riding a horse together. Like just thinking of in terms of like the amount of horses, you know, horses are already kind of at their max workloads, but doing like a grooming program, I think with families would be a really great way to involve them together. Even just having like a family day where they go out and have a tour of the farm and give the horses treats and learn about the horses' feeds and, you know, where the horses sleep and how you clean a stall and that sort of thing, I think could be some ideas. Please come to Victoria. That would be great. Love to go to Victoria. Bridget, thanks for taking your perspective. Awesome.
Hi there, Karen. Can I pop in and ask you a question?
Yes, I don't know who is.
Oh, it's Ashley Dowler. I'm from Calgary area. So I just had a question. I love this study. I'm a therapeutic riding instructor, but I'm also a therapy assistant. And so I'm kind of, my question comes with all these kiddos with CP. Like, it seems, they tend to kind of be full of therapy activities in general, right? Like, they're always seeing physio and OT and sometimes speech, but they're kind of chock-a-block full of all these activities that they're having to do to try to, build skills or improve on things. And so did you guys ever look at kind of, when we look at like the fun aspect, did we see any, or did you guys find any correlation between maybe a little more fun with therapies, because they are getting some of like those physical benefits as well? And does that ever create more happiness in their therapies where it maybe doesn't always feel like work?
Right. I definitely see what you mean. We didn't really, there wasn't really a way to measure that, I guess, in this study, just because it was pretty small. And like, that wasn't something we were really looking at. It was more the therapeutic horseback riding itself. But I think definitely like that would be something interesting to explore in the future. And like, I had kind of hoped, like with independence or something, that we would see, like that translating to other life situations. Because like I have heard it anecdotally, but it didn't really show itself in this, which is totally fine. But definitely, I think something to continue to look at. And that's same with like what you're saying, like, is it, having the horse such a positive experience and then maybe going to physio and not having the best time, maybe it would make it better. I don't know. It would be nice if it did.
Yeah, I'm just thinking about, all like the fun, right? Like, it's just because they are getting some of those other benefits, obviously not in like a hippotherapy way, but from that therapeutic way. And is it just like a good, like a bit of a break, but still working on some of those things? So yeah, I was just interested to see if you guys had, just heard anything like, from that.
Not really.
Nope, that's okay. Thank you.
Well, that's about time now. So I'm going to say thank you, Karen, one last time, and thank you everyone else for joining us this evening on our call. I'd like to wish everyone a happy and healthy evening.
Great. Thanks so much, everyone. Thanks for tuning in.